Sure. Today I'm here to speak in support of Senate Bill 380, the Kinship Guardian Assistance Program. Children's Trust was established in 1984 by the South Carolina General Assembly, Title 63, Chapter 11, Article 9, as the South Carolina's Children's Trust Fund. It is an eleemosynary corporation that awards grants to private nonprofit organizations and qualified state agencies to fund a broad range of innovative child abuse and neglect programs to meet the critical needs of South Carolina's children. We are the only statewide organization focused on preventing child abuse and neglect before it happens. We lead and support a network of community-based organizations which share the belief that all children should thrive, live in secure families, and be surrounded by supportive communities. To that end, we fund proven prevention programs, conduct high-quality data and trend analysis, and offer training for professionals so they have the tools they need to help children and families in counties across our state. Among our many programs and initiatives, we lead the South Carolina Adverse Childhood Experiences, or ACEs, initiative. The original ACE study showed the long-term effects of childhood trauma on adult health and behavior. In a perfect world, every child would have a safe, loving, and nurturing home, and no child would ever need to be removed from their home or separated from their parents. But we don't live in a perfect world, and our colleagues at the South Carolina Department of Social Services too often must intervene to ensure safety and stability for the children. Under the leadership of Director Michael Leach and his leadership team, DSS has worked hard to promote kinship care, which allows children who have been removed from their homes to stay with relatives and/or family friends. These practices give children who are in the midst of tremendous family upheaval and trauma the opportunity to be cared for by those who know them and in communities that are familiar to them. For a child who has been removed from their parents in an incredibly difficult and sometimes unspeakable circumstances, these children's experiences can be terrifying and toxic. As mentioned before, we know the effects of these ACEs, the shorter-term behavioral issues, psychiatric disorders, and school disruptions, as well as the long-term negative health and social outcomes as adults. So as we like to say, when we know better, we need to do better. It is up to us to do all we can to help kids settle into their new normal with as few disruptions as possible so that they can begin their healing and recovery process. And while we all recognize and appreciate the critical role foster care can play in a child's life, guardianship offers children the stability of a permanent home while maintaining connections to family, friends, and community, especially when adoption is not feasible. Unfortunately, South Carolina is one of 10 states that has not opted into the federal Title 4E Guardianship Assistance Program. This federal formula grant program allows relatives who have assumed legal guardianship of eligible children to receive assistance payments similar to those that foster parents receive. We believe South Carolina should do everything it can to support families, especially those involved in kinship care. We believe opting into the Guardianship Assistance Program would be a big step in the right direction for these vulnerable children. I appreciate your attention to this matter and thank you for your commitment to the children and families in South Carolina.
All right. Thank you, Ms. Williams.